Greetings from Kokilaben Dhirubhai Ambani Hospital. I am Dr. Tanuja Karande. I am a consultant pediatric cardiologist, and today we are going to talk about a condition known as dilated cardiomyopathy and a little bit about heart transplant. What is dilated cardiomyopathy? Cardiomyopathy is a disorder which affects the heart muscle, and this is a condition wherein the heart muscle tends to become weak and the heart is unable to pump blood to the whole body, leading to heart failure. Now, this can occur because of a variety of causes, most important of which are genetic, wherein you have an abnormal gene which runs through the families, causing weakness of the heart muscle. Second and most important cause is myocarditis, wherein because of some viral infection, the heart muscle tends to become weak. Now, this condition can affect anyone from a newborn to adulthood, and that is why the signs and symptoms depend based on the age. A baby can present with difficulty in feeding, increased fussiness, excessive crying, and poor weight gain, whereas an adolescent or a teenager can present with stomach-related problems such as repeated vomiting, difficulty in eating, poor appetite, and reduction in the stamina. What is the treatment? So initially, your doctor would start you on certain medications known as anti-failure medications, trying to reduce your symptoms and improve the cardiac function. The treatment would take somewhere between 3 to 6 months, and if at the end of the treatment the doctor feels that there is no improvement or the condition continues to worsen, then you would be advised a heart transplant. A heart transplant is a surgery or a major surgery wherein the diseased or the weak organ is removed and it is replaced by a healthy donor heart. Since not everyone can undergo a heart transplant, initially you would be subjected to certain tests to see whether you are an eligible candidate for transplant. Once all the reports arrive and the team feels that you are eligible for a transplant, your name would be listed at the ZTCC or the Zonal Transplant Committee. Whenever a suitable organ offer is made and the team feels that it is an ideal match for you, then the organ will be available for transplant for you. The surgery is a major surgery. It is an open heart surgery undertaken on bypass, and it would last somewhere between 4 to 6 hours. It is important that the patient reaches the hospital within 2 hours of the offer which is made for the transplant. Following surgery, the child would remain on ventilator for the first 2 to 3 days, after which slowly and gradually the child would be given food and medicines, and the ICU stay would last for somewhere around 4 to 6 days. By the end of 7 to 10 days, the patient can get discharged home. After transplant, usually the doctor would prescribe you a few medications which are known as immunosuppressants, and these medicines are given to reduce your immunity such that the heart is not rejected. Since these are immunity suppressing medicines, there is slightly higher chance of infection, and your doctor is always going to be on the lookout for rejection as well as infections. Following transplant, it is ideal that the individual maintains a healthy lifestyle, continues the daily activities, and within a span of 4 to 6 months can even participate into sports once the doctor advises that you are fit for it. Since this is a costly surgery, there are a few organizations which are now appointed to help the family in arranging finances and reduce the financial and the mental burden.